Hello, this is Fadi Al Fayoumi giving the presentation of the Vein Clinic proposal for 6.1 assignment for the Capstone A project at Washington State University MBA program. So with our product description, the Heart and Vascular Clinic will add vein disease outpatient procedures to treat spider veins, varicose veins, and to provide an avenue for early detection and treatment of vascular disease. The number of gurus I talked to in the field of vein disease and management was 3 this week, and that's what's up to date. And we've talked to about 10 customers regarding their vision and perception of what the vein clinic might provide and what their responses would be in terms of accepting the treatment and looking forward for results. So the business model canvas, the key partners in this project will be Valley Baptist Medical Center, which will form a joint venture with the clinic to start the vein clinic, along with the heart and vascular clinic. Of course, we will be dealing with medical companies which are going to provide supplies as far as the radiofrequency ablation catheters, the laser ablation catheters, the materials we're going to use for the sclerotherapy, needles, gauzes, injections, along with tools like the phlebectomy tools, which are used for minor surgical interventions in the office to take some of those spider veins out at an outpatient under local analgesia. Patient feedback and the word of mouth will be a key feature for the referrals of the patients, and that has been repeated over and over again and confirmed by multiple gurus in the field of vein disease and management. And of course, dealing with the insurance companies, which are going to be the primary payers with what we call a disease status rather than a cosmetic results. So when it comes to the vein disease and we look at outpatient centers, those who represented a center of excellence in the nation, they run about 60% disease management versus 40% cosmetic services where the patient is going to pay out of their pockets. When it comes to the multiple and many vein clinics in the nation where the primary provider is providing a cosmetic service based on a short-term education and lack of deep knowledge in the field, they run about 80% cosmetic services and 20% disease management, and typically they end with referring the difficult cases to the big centers, and eventually there will be a line drawn for the peak at which their business can get to or achieve. So the key activities of our vein clinic will be the quality of the service being provided along with patient education. This is an important parameter in my business. Patient education. Patient education is not only about the appearance in your legs, and it's not only about you're going to look good when you walk down the beach or when you have shorts on, but it's actually going to prevent further problems down the road. That's a very important key in this business and in this medical era. And the key resources will be the experience of the doctors, nurses, medical assistants, along with the support personnel. The problem we're dealing with here is a vascular disease. It's not varicose veins only. It's a vascular disease, and that's the perception we're looking at here. And as long as we follow this path of teaching the public and the patient that it's a vascular disease that can have consequences on your own health, the cosmetic appearance is only the tip of the mountain of it, it's only the superficial part of it, then things will go significantly successful and the clinic reputation will go viral and the success will be beyond belief. It's the same way when I started doing my heart and vascular clinic, and the clinic performance remains to be top 1% in the nation so far. The customer segment will involve patients with vein thrombosis, clinical complications, patients with varicose veins, patients with spider veins, and patients with deep vein problems. So when we did the hypothesis that once patient learns about the health risk associated with varicose veins and spider veins, that they will seek treatment, we ran a survey, and that survey was developed, and we selected 10 random patients over a 2-day period, and we provided education regarding varicose and spider veins. And the survey, when it was given, it was discussed with the gurus in the field, particularly Dr. Jose Almeida and Dr. McKay, and they all agreed with the same strategy. This is the way they started their business, and this is the way they pursued their success eventually. Patient education, showing them it's a disease rather than a cosmetic service. And once we follow that pathway, the feedback from those same patients that yes, if that was a disease process, not only a cosmetic service, and I was not aware of that, then I will be more than willing to pay out of pocket for a service, and I'll be more than willing to consider a preventive therapy rather than a therapeutic option to wait for symptoms to appear. And therefore, we're going to continue to expand the patient's education and survey for the heart and vascular clinic patients and to non-HVC patients to expand the service of the clinic. And that eventually will also provide feedback to HVC patients. And that's our business model.